Good morning. Welcome to Start Your Day with Dr. Gray, and I am Dr. Gray Urlacher at Urlacher Medical Services in Rocky Mount. And today I want to talk about memory and dementia. So stick around, I'm going to talk about the signs of dementia and what you can do to prevent it. But it reminds me of an old joke, and I'm going to dare to tell a joke. This goes back to the Clinton administration. And so the joke goes like this. President Clinton and his Secret Service team were visiting a nursing home. And he's going around and says, "Oh, nice to meet you. Thank you. I appreciate your vote." And greeting himself to everybody. And there's this woman who's staring at him. She looks at him and he says, "Do you know who I am?" That's my Bill Clinton impersonation. "Do you know who I am?" And she looks at him. She says, "No, but if you ask the nice lady behind the desk, she can tell you." So dementia is actually very common. 7 million Americans have dementia. 1 in 9 people over the age of 65 has dementia, and it's expected to double in the next 30 years because the population is getting older. About 1/3 of adults over 85 have dementia. And, despite the joke, this is a very tragic thing. It's tragic for the patient, of course, because they can tell something's wrong. But it's also very tragic for the family. And it's a big burden to take care of somebody with dementia. They need constant care. They need a lot of attention. And it's just emotionally challenging when your loved ones don't recognize you as dementia becomes more advanced. So what I want to do is, if you've been if you're over 65 and you've been in for a Medicare annual checkup, they will do what's called a mini cog or a mini cognition test. And some of you may have taken this. It's kind of a routine Medicare thing. And so one of the first tests is this, and I'm going to ask you to remember 3 words. And then in a few minutes, I'm going to ask you to repeat those words to me. So the 3 words are apple, table, and penny. Apple, table, and penny. Okay, remember those. Apple, table, and penny. And in a couple minutes, I'm going to ask you to recite those back to me. Don't write them down now. If you're at home, that's cheating. You're not allowed to do that. The second part of the test is they will give you, if you can see this on TV, a circle. And they'll tell you to draw a clock face with the numbers and then make the hands of the clock say 10 minutes after 11. So, it's kind of funny because this isn't an absolute test for dementia. Some people are just not very good with clocks, and I don't even think they're teaching clock faces in school anymore. So someday this test may not be very effective, but most of us know how to read a clock face. So the best way I do it when I've taken the test, I actually took the test this morning, is you start with a 12 at the top, and then I put the 6 and the 3 and the 9, and then fill in the numbers around that. But some people will just start right at the top and they'll go 1, 2, 3, 4, 5, and they don't even get halfway around the circle, or they have trouble handwriting. So this is, it can detect a lot of things, but it's a rough screen for dementia, actually. And this is what it should look like. If you can see that, 10 minutes after 11, you can see that I did the 12, 3, 6, 9, then filled in the rest of the numbers, put the little hand on the 11, and then the big hand on the 2, which is 10 minutes after. And that's a typical screening test you'll have. So now, what were those 3 words? I'll give you a second. Okay, it was grapefruit, chair, no, I'm just kidding. Apple, table, and penny, okay? All right, so those are a rough test. And even if you fail that test, and there's a few more questions in there, they'll ask you where you are, and questions like that. It's not an absolute test for dementia. There is no absolute test for dementia. It's a combination of recognizing the signs and symptoms. There is a blood test that can help. This is actually very new, a blood test that can help make the diagnosis, but again, it's not absolute. Typically, they'll do some blood work to be sure there's not some other reason you're having memory problems, like a nutritional deficiency or a thyroid problem, something like that. And then they'll do an MRI just to be sure to look at the brain. But again, even looking at an MRI, you can't absolutely say that's dementia in most cases. And dementia is really not just one disease. Dementia is more like a syndrome. It's a syndrome of a memory disorder. It's progressive. It gets worse over time. But also thinking, reasoning, recognizing people, using good judgment. And this is where a lot of the early symptoms you can detect dementia. Ironically, the family is often the last to recognize it. People are able to compensate for their memory problems. A lot of times in conversation we have automatic responses. You say, "How are you doing?" And people will say, "I'm fine." Well, that's just sort of a natural automatic response. You're not really getting into depth in the conversation. So a lot of times family members won't recognize it and until the symptoms become much worse or an incident happens of some sort. So a lot of people say, well, maybe I've got dementia. I walked into the kitchen, I couldn't remember what I went in there for. Well, that's kind of benign forgetfulness is what I like to call that. And that does tend to get a little more prevalent as we get older. You misplace your keys, you can not think of the right word, you can't remember somebody's name and you should know their name. These are kind of normal signs of aging. I think our brains just get filled with so much information over a lifetime that it takes a little longer to go through those files to find somebody's name or the information you're looking for. So I call that benign forgetfulness. I don't think that's really a medical term, but if you walk in the kitchen and you can't remember what you went in there for, that's not necessarily dementia. The early signs of dementia are more like you're misplacing things, but then you just can't even remember where you were or how you got there. You can't follow conversations, trouble doing things like planning or solving problems, balancing a checkbook, paying bills. A lot of times that's an early sign. People are forgetting to manage these life activities. Making bad decisions. And a real common one that I see is getting lost in familiar places. That's a question I ask if somebody brings in a family member or someone comes in and says they're worried about dementia. I ask them, well, are you getting lost when you go out driving and trouble getting home? That's actually an early sign and a symptom. Personality changes, loss of motivation. Sometimes there's some mood or emotional changes that we see. Another common symptom is misplacing things, like for instance, instead of putting the milk back in the refrigerator, they put it in the oven, or confusing things like that. So those can be signs of early dementia. But again, just some benign forgetfulness is not the same thing as dementia. As it gets worse, they will forget the season, the dates, the time. They have trouble preparing meals. They may wander off. They get lost driving home, anxiety, trouble recognizing people that you should know that are closer family members. And sleep disturbance is also a common symptom of dementia. They call that sundowning, where the day and night get switched. They're up all night and then sleeping throughout the day and sleeping erratically. As dementia becomes more advanced, they get to the point where they don't recognize close family members, or they'll mistake them for someone else. And this is very sad. It's very sad for the family, of course. Their speech, they begin to lose their ability to speak, unable to take care of themselves, dress, bathe, feed themselves. They become more immobile, and of course they become very dependent. And it's just a very tragic thing, and we want to do all we can to prevent that. I'm going to give you some tips on how to prevent that. One thing I didn't mention, I guess I started to say that dementia is not really just one disease, it's a syndrome. It's that syndrome of memory loss, memory and thinking, reasoning, emotional balance, sleep. And Alzheimer's, of course, is the most dominant type. That's probably 3/4, maybe 80% of cases of dementia are Alzheimer's. But there's also what they call vascular dementia. And I think that's pretty common in the South, where we have a lot of vascular disease. And by vascular disease, I'm talking about blocked arteries, same thing that causes a heart attack or a stroke. This can also lead to dementia. If somebody has lots of tiny little strokes where the circulation to the brain is compromised, that can lead to a state of dementia that looks just like Alzheimer's. Sometimes they're indistinguishable, and that's part of the reason that we do an MRI, just to kind of see what kind there is. And there are some other uncommon types of dementia. You may have heard of Lewy body disease. That's also a type of dementia. Maybe 5% of cases are Lewy body disease. And that is also can be a very progressive one. Patients will have hallucinations, and it's a very difficult syndrome to treat. So what can we do to prevent that? We talked about how they evaluate it. There are risk factors for dementia. It can run in the family, and that does increase your risk factors. That's where the blood testing comes in handy. But the risk factors are family history, and then the other chronic diseases that we think of: diabetes, high cholesterol, smoking, that's something you can actually prevent. Physical inactivity, that's also a modifiable risk factor. Obesity, hearing loss, and that's one that's of personal interest to me because I have hearing loss and wear hearing aids. And one of the important ways to prevent dementia is by wearing hearing aids, which I'm not wearing today, ironically, so I'm not setting a very good example. Sleep apnea is a risk factor which can be treated, of course. Depression and social isolation. So a lot of the ways to prevent dementia are to address these things that you have some power over. You can't really choose your parents as far as your family history, but you can choose to quit smoking, for example. And today would be a good day to do that, by the way, if you smoke. So here's my prescription. Yes, here we go. Regular exercise, about 150 minutes a week. And that's why I'm wearing this shirt today. This is from, I can't quite point to it, here it is. More for Your Body Fitness in Rocky Mount. And not everybody in there is young and looks like a Greek god or something. In fact, some days I'm the youngest person in there. But I'm just giving an endorsement here for More for You Fitness. It's over there by Harris Teeter on Sunset Avenue. Talk to Kelvin. He can help you get on an exercise plan to get enough exercise to help, and this helps prevent dementia as well as a bunch of other things, and quality of life. But that's number one. I mean, the number one recommendation is regular exercise, walking every day, doing some strength training, participating in some kind of group exercise activity, which also counts as a social activity, which is one of the other things that we can do. So number one is exercise, and that includes strength training and walking. Controlling your blood pressure, diabetes, and cholesterol, as the case may be. Social engagement, lifelong learning, sleep. 7 to 9 hours of sleep has been shown. These are all based on studies too. I'm not just making this up. 7 to 9 hours of sleep a night has been shown to help prevent dementia. Treating hearing loss with hearing aids. Avoiding alcohol and tobacco, both of those contribute to dementia. All right, we talked about the risk factors. So here's my prescription, the Practical Brain Health prescription. Number one, walk every day. Number two, get regular exercise and some resistance training, strength training. This can just be some little dumbbells you do in the house. You don't have to go to a gym or do something formal. If you smoke, quit smoking today. Reading has been shown to help prevent dementia, even just 20 to 30 minutes. And if you don't want to read, you could even do some writing, write in a journal, write some poetry, do something creative with your mind. Stay socially active, participate in activities. I think going to some kind of social activities, church functions, family gatherings, being among people is very important in maintaining your brain health, and that helps prevent dementia. Getting 7 to 9 hours of sleep per night, 8 is kind of a good number. Quality sleep makes a big difference. Keeping your blood pressure and your blood sugar under control. which is a big problem around here. Diabetes is very prevalent in eastern North Carolina, and that does contribute to dementia. Wear hearing aids and lifelong learning. This recommendation said to learn one new skill a year. That could be learning how to operate a machine, taking a class. If you're a senior, there are a lot of classes that are available. You can even, some universities, colleges, community colleges have classes at a discount or even free for senior citizens. And take advantage of that. Learning is the best way, one of the best ways to prevent dementia and to keep your mind fit. Your brain is a lot like a muscle. If you don't use it, it's going to atrophy. So if you're sitting at home, you don't get up, and you're not interacting with people, learning new things, then your brain is going to be just like a muscle. It's going to atrophy, and that leads to dementia. So those things are very preventable. They even talk about having a lifelong curiosity. If you see something that you're interested in, learn about it. We have access to so much information so easily today. Learn about new things. Think about new things. Curiosity, never stop being curious, is a great prevention for dementia. So the treatment for dementia, prevention is really the key, because there is not a lot of treatment for dementia. We do have some medications. There's some new monoclonal antibody injections that they can give that help. The medication does help some. It seems to slow the progression, but we don't have a cure for dementia. It helps to do all of these things. It's never too late to start exercise. And maybe if you were very intent about exercise, challenging your brain, you could really slow down that progression. But the best thing is to prevent it all in advance if possible. The treatments, there are medications, donepezil, which I think is called Aricept. There's a couple of other oral medications. We do use those, and they do seem to help a little bit. Sometimes we'll treat some of the behavioral issues, things like that. But none of these are actually a cure. Again, the best thing is to do all you can to prevent dementia. One other thing I was going to mention is that we see this a lot, where patients become confused and they think something else, someone is someone else. You don't have to argue with them and try to bring them back to reality. That can be very agitating. In fact, I know of there's a nursing home where they have a bus bench in front of the nursing home because people kept going off and getting on the bus. So they put a fake park bench up there, or a bus bench, and they would wait, and then they would think they missed the bus and come back in. So you don't need to argue with somebody who's got dementia. Just calmly go along with what they believe, and not to try to argue. That's not going to really help the situation. So if you or a loved one are concerned about dementia and want to get further testing or have more questions about it, feel free to contact us. I'm at Erlacher Medical Services. I have a website, erlachermedical.com, and you can also call us, 252-316-5772. And the fact that I can remember that is a good sign that I don't have dementia yet. I just need to go put on my hearing aids now and get a walk-in. But anyway, thanks for tuning in. I look forward to seeing you. We're here every Thursday, every second and fourth Thursday here on WHIG TV. And I hope you have a great day. Thank you very much.